What is knowledge? Simple question, complex answer. The dictionary tells us that knowledge is understanding or information gained about a subject through experience or study. And why do we need to think about knowledge? Well, it hits to the heart of the teaching in dentistry. Because without understanding what knowledge is, we can't work out how to effectively learn ourselves, how to effectively teach, and how to successfully assess. Is knowledge simply the gaining of factual information? Is knowledge the gaining of a new skill? Or does knowledge require understanding? And why is it important? It's important because if we don't get it right, we will teach the dentists of the future in the wrong way and not be able to serve the communities that the dentists are there to serve in the appropriate manner. This is my dog, Dexter, who's a very good student. And Dexter learnt as a puppy very quickly how to walk appropriately on the footpath away from the cars. He did this by bribes, mainly food, and eventually, in fact it didn't take very long, about a week if that, Dexter walked without the bribe on the correct side of the footpath. Now he's learned new information, he's developed a new skill which he now does independently. But does he understand why he's doing it? And does that matter? A problem that humanity has mulled over for millennia, since the time of Socrates, who insisted he was not a wise man, and indeed insisted he wasn't even a teacher. Until his friend Catharon went to the Oracle of Delphi. Apollo's oracle declared Socrates as the wisest man there is. Socrates was absolutely apoplectic, he was livid. So he went to prove his friend wrong, and he walked amongst the great and the good of Athens. He interviewed the bankers, the great poets. And what he found out is that even the great poets couldn't actually explain the meaning of their own poetry. They developed a skill, they could write beautiful verse which looked incredibly complex, but they couldn't actually explain what it meant. And Socrates actually then concluded that he was indeed a wise man because he knows nothing, but he knows nothing. And what it's saying to us is that the important aspect of knowledge is not so much the acquisition of facts or indeed a new skill, but being able to understand what these facts mean when they're presented in an abstract form. So understanding is essential for us to work in practice. It's essential because patients don't come to see us with textbook list of symptoms. Patients will come quite commonly, as we all know as dentists, with fairly vague symptoms which often conflict and when put together make little sense. So what we need to instill in the dentists that we train is the skill of diagnostic reasoning, where the dentist is taking abstract concepts such as abstract symptoms, abstract signs sometimes, but noticing patterns and being able to analyse those patterns to try to formulate a hypothesis of a potential diagnosis, from which the dentist will determine further tests to make and then hopefully come up with a definitive diagnosis. And that is the heart of what we will do on the programme in dental education, to teach you as attendees, as learners on the programme, how to understand the models and the educational frameworks we give to you, rather than just memorise them. Because if you understand them, you'll remember them for a lot longer, and you'll be able to make use of them in your own context of teaching, which is not textbooks. Everybody has different learners, different fields of expertise. And that thankfully is a tradition at Cambridge, where the acquisition of knowledge is not so much the focus, it's more the acquisition of understanding. Thank you.